Recognize the early warning signs immediately. Most heart attacks begin subtly, and seniors often misinterpret symptoms as fatigue, indigestion, or muscle strain. Yet, knowing the warning signs can mean the difference between life and death. Symptoms can include chest discomfort, pressure or tightness that lingers, pain radiating to the jaw, neck or arms, shortness of breath, cold sweats, nausea, and sudden dizziness. Contrast this with the typical scenario where seniors dismiss mild discomfort as normal aging. Imagine a man over 65 sitting alone, feeling light chest pressure after climbing stairs. He assumes it's just shortness of breath from being out of shape. By the time he recognizes the seriousness, crucial minutes have passed. Instead, immediate recognition triggers the exact sequence that saves lives. Sit upright, call emergency services, take aspirin if not allergic, and prepare to follow your emergency plan. To train your mind, mentally rehearse scenarios daily. Create a checklist of symptoms to glance at regularly. The more familiar your brain becomes with early signs, the faster your reaction under stress. Seniors who practice this recognition often call for help within minutes, limiting heart muscle damage and increasing survival odds by 40 to 50%. Tip number 2. Call emergency services immediately and clearly communicate your situation. Time is critical. Every minute the heart is deprived of oxygen increases damage exponentially. Seniors often hesitate. Fear, embarrassment, or uncertainty can delay action. Contrast this with decisive action, dialing 911, calmly stating your age, location, known medical conditions, and current symptoms. If possible, place your phone on speaker mode and keep it within reach. This allows you to begin step 3 while emergency personnel are en route. Practice this communication in advance, memorizing your key details. If your voice shakes or panic sets in, having this script reduces confusion. For seniors living alone, consider alert devices that automatically dial emergency services with a single button press. These systems are invaluable, particularly for those with limited mobility or who may be too weak to reach a phone. Real-life studies show that patients who called immediately after symptom onset had significantly higher survival rates and fewer long-term complications. Contrast this with waiting or attempting self-transport, which often results in fatal delays. Tip number 3. Chew an aspirin unless contraindicated. Aspirin thins the blood and slows clot formation, which can reduce heart muscle damage. Seniors often neglect this because they forget or worry about side effects. Contrast this with timely ingestion immediately after recognizing symptoms. Chew a regular 325 mg aspirin, or as instructed by your doctor. Chewing ensures faster absorption than swallowing whole. This single action can limit the size of a heart attack, buying valuable time for EMS arrival. Store aspirin in multiple accessible locations in your home. Review with your healthcare provider beforehand if daily aspirin use is safe for you. Remember, this is not a substitute for professional care. It is a temporary, life-saving measure while help arrives. The difference between taking it immediately versus not taking it can literally be the difference between survival and irreversible cardiac damage. Tip number 4. Sit upright and stay calm. Panic increases heart rate, elevates blood pressure, and worsens oxygen deprivation. Lying down may feel natural, but it can increase strain on the heart. Contrast this with the optimal approach. Sit in a sturdy chair, lean slightly forward with feet flat on the floor, and place your hands on your knees. This posture reduces strain, aids blood flow, and supports lung expansion for better oxygen intake. Breathing exercises, slow inhalations through the nose, exhalations through pursed lips, can stabilize heart rate and reduce anxiety. Real-life scenarios demonstrate that seniors who maintain calm, upright posture often experience reduced symptom severity and remain conscious until EMS arrives. This step also enables you to take aspirin, monitor your breathing, and prepare for further interventions without wasting energy or causing additional cardiac stress. Tip number 5. Use nitroglycerin if prescribed and follow the proper administration technique. Nitroglycerin dilates blood vessels and can relieve chest pain during acute episodes. Contrast correct use with common mistakes, placing the pill under the tongue but standing or walking, which reduces effectiveness, storing it improperly so potency declines, or forgetting to carry it in multiple locations. Optimal administration involves sitting, placing the tablet under the tongue, letting it dissolve fully, and resting quietly. Keep extra doses in accessible places like the bedroom, kitchen, and living room. Track expiration dates to ensure efficacy. Seniors who consistently follow this procedure experience rapid symptom relief, buying critical minutes and reducing the intensity of heart muscle injury. Tip number 6. Prepare for self-rescue actions if you lose consciousness or can't move. This includes learning the Heimlich, like chest compression self-aid technique, sometimes called the precordial thump or self-compression on a sturdy surface. While not a substitute for CPR performed by trained personnel, it can briefly stimulate cardiac rhythm in rare cases. More importantly, planning in advance ensures you have instructions and a clear procedure ready. Contrast this with the common scenario of collapse with no plan, where seconds are wasted and survival odds plummet. Seniors should practice mobility drills, rolling safely from bed to chair, reaching emergency communication devices quickly, and keeping floors clear to prevent falls. Visualizing and rehearsing these actions ensures rapid response under real-life stress. Tip number 7. Have a post-attack plan. Surviving the initial heart attack is only the first stage. Once EMS arrives, treatment is immediate, but the next critical hours involve medication, rest monitoring, and often hospitalization. Seniors should pre-arrange contacts, family, neighbors, and doctors, so someone can check in immediately after EMS departure. Know which medications you'll need, which diet adjustments to follow, and how to gradually resume activity. Contrast this with unplanned recovery confusion, delayed medication adherence, or physical overexertion can trigger recurrent attacks. A structured plan ensures that the survival advantage gained during the acute event translates into long-term health improvements. Each of these tips is interconnected. Recognizing symptoms triggers the emergency call, aspirin, and upright posture. Nitroglycerin may relieve pain while awaiting EMS. Pre-planned self-rescue actions provide a safety net, and a post-attack plan ensures continued recovery. The difference between survival and tragedy is not luck. It is preparation and deliberate execution of each life-saving step. Contrast this with seniors who remain passive or rely solely on chance. Delayed recognition, panic, and lack of preparation drastically reduce survival probability. To embed these habits, create a heart attack survival kit in your home. Include a charged phone, emergency numbers, aspirin, nitroglycerin, a chair for immediate sitting, a water bottle, and clear instructions for self-rescue. Place this kit in multiple accessible areas. Conduct weekly drills, mentally walk through each step, even simulate taking aspirin or sitting upright while dialing 911. Research shows that seniors who rehearse emergency procedures are faster, calmer, and more effective during real events. Another overlooked factor is mindset. Many seniors fear heart attacks, leading to stress or denial. Instead, cultivate a mindset of empowerment. Knowledge, preparation, and proactive practice convert fear into actionable confidence. Contrast a panic-driven response with a calm, rehearsed plan. The latter improves oxygenation, heart efficiency, and decision-making under duress. Combine this with the physical preparations outlined earlier, hydration, medication readiness, and home safety, and you create a layered defense that maximizes survival odds even when alone. Finally, communicate your plan with loved ones. Even if you live alone, sharing your strategy, location of medications, and emergency procedures ensures that if neighbors or family members intervene, they can assist efficiently. Contrast this with secrecy or isolation, where bystanders are unaware of your condition and valuable minutes are lost. Regularly update them on health status, check-ins, and medication changes. Social reinforcement reduces anxiety and provides an extra layer of security for seniors navigating heart attack risk independently. By combining recognition, immediate response, proper medication use, upright posture, pre-planned self-rescue techniques, and post-event preparation, seniors living alone over 60 can transform what seems like a terrifying vulnerability into a controlled, manageable scenario. Contrast this with unprepared seniors who experience panic, confusion, and delayed intervention. The difference is not just survival, it is quality of life, reduced damage, and peace of mind knowing that every possible step has been taken to protect your heart. Imagine this: you're at home, maybe sitting in your favorite chair, or just finishing a quiet dinner, when suddenly you feel it. A crushing pressure in your chest, radiating into your left arm, a cold sweat forming on your forehead. Your heart is racing, your breathing feels shallow, and for a terrifying moment, you realize you might be having a heart attack. And worse, there's no one around to help. No family nearby, no immediate medical assistance, just you alone, facing one of the most critical emergencies of your life. For anyone over 60, this scenario is not just a nightmare, it's a reality that experts say is alarmingly common. The truth is, heart attacks do not always happen in hospitals or during a routine checkup. They often strike when you least expect it, and being unprepared can make the difference between survival and tragedy. Statistics show that over 60% of heart attacks in adults over 60 occur at home, and about a third of these are solitary experiences. That means millions of seniors are at risk every single year, facing what doctors call a silent killer without immediate help. But here's the thing that most people don't know: survival is possible, even when you're alone. And it's not just luck, it's knowledge, preparation, and the right actions in the first critical moments. In this video, we're going to reveal 7 life-saving tips that can dramatically increase your chances of surviving a heart attack when you're by yourself. Each tip is rooted in medical research, expert advice, and real-world experience. And by the time you finish watching, you'll know exactly what to do to protect your life if the unthinkable happens. Before we dive into the steps, let's talk about why age matters. After 60, your cardiovascular system changes in ways that make heart attacks more likely and recovery more challenging. Arteries stiffen, blood pressure rises, and the heart's ability to recover from stress diminishes. This doesn't mean heart attacks are inevitable, but it does mean that every minute counts. Every second you hesitate can cost vital heart muscle, and in a worst-case scenario, your life. But here's the empowering truth: with the right knowledge and preparation, you can turn a terrifying emergency into a manageable situation, even without someone by your side. Let's start with the first critical step: recognizing the signs early. Unlike in movies, a heart attack rarely announces itself with dramatic flair. Chest clutching pain isn't always the first symptom, especially in older adults. Instead, you might notice subtle signs: fatigue that feels unusual, a tightness or discomfort in your chest that comes and goes, shortness of breath, dizziness, or even nausea. Women and men may experience these symptoms differently, with women often showing less obvious indicators. Understanding your personal normal is key. If something feels off, don't ignore it. Early recognition allows you to act immediately, which can literally save your life. Next comes the first life-saving tip: call emergency services immediately, even if you're unsure. Yes, it's natural to hesitate. You may worry it's a false alarm or that the ambulance will take too long. But studies consistently show that calling for help as soon as symptoms appear increases survival rates dramatically. If you are alone, place your phone within reach at all times, whether it's on a nightstand, in your pocket, or nearby in the kitchen. Consider a medical alert device or a smartwatch that can call emergency contacts automatically if you collapse or are unable to reach your phone. Timing is everything, and the first 5 minutes are critical. Even if the pain seems mild or the discomfort passes, don't delay. While waiting for help, there are immediate actions that can reduce damage to your heart and improve survival odds. The second tip: chew and swallow aspirin if recommended by your doctor. Aspirin works by thinning the blood, helping prevent clot formation that can block arteries and worsen a heart attack. If you're allergic or have been advised against it, skip this step. But if you have no contraindications, keep a few low-dose tablets accessible at home. Place them in a spot you can grab quickly, like next to your bed or in the kitchen cabinet. This small, seemingly simple action can have a dramatic effect, giving your heart the extra time it needs until professional help arrives. Simultaneously, position your body to reduce strain on the heart. This is tip 3: sit upright, lean slightly forward, and try to remain calm. Lying flat may make breathing more difficult and increase pressure on the heart. Leaning forward slightly, perhaps resting your arms on a table or your knees, can help your heart work more efficiently and improve oxygen flow to critical areas. It also signals to your body to slow down, which can reduce panic-induced spikes in heart rate and blood pressure. Coupled with controlled, steady breathing, this positioning gives your heart a fighting chance during the minutes that matter most. Tip 4 is often overlooked but can be life-saving. Use nitroglycerin if prescribed. For those with a history of angina or heart disease, keeping nitroglycerin on hand can ease arterial constriction and improve blood flow to the heart. Place it exactly where you can access it immediately and follow your doctor's instructions carefully. Many seniors don't realize the importance of preparation. Having your prescribed medications ready, checked for expiration, and easily accessible can mean the difference between a minor incident and a catastrophic event. Tip 5: remain mentally focused and avoid panic. Adrenaline can surge during a heart attack, and while it's natural to feel fear, panic can worsen heart strain. Instead, try a mental strategy that doctors recommend for isolated emergencies. Focus on what you can control. Repeat a calm mantra, remind yourself that help is on the way, and monitor your symptoms without exaggeration. Mental clarity allows you to make critical decisions, like positioning your body, taking medication, or grabbing your phone for emergency services. At this stage, you might be wondering about movement. Tip 6: light, careful movement only if necessary to access help. Don't rush or strain your heart by walking or climbing stairs unnecessarily. If you need to reach your phone or a medical alert device, move slowly and deliberately, pausing to catch your breath as needed. Every effort should prioritize stability, avoiding falls, and preserving energy for your heart. If you have someone nearby who can see or hear you, make noise to attract attention, but never compromise your heart by rushing. Finally, tip 7: no post-attack survival measures. While the immediate focus is getting help, knowing what to do after the first wave of symptoms is equally important. Keep emergency contacts updated, maintain a record of medications, and ensure your home is equipped with essentials like water, a first aid kit, and oxygen if prescribed. Preparation is not just about surviving the attack, it's about reducing the likelihood of a second one and ensuring your heart recovery starts as efficiently as possible. By combining these 7 tips, early recognition, calling for help immediately, taking aspirin if safe, proper body positioning, using prescribed nitroglycerin, mental focus, careful movement, and post-attack preparation,